In the recent times, we have seen an increased awareness of the health benefits of walking. Even more highlighted is the 10,000 steps a day trend, which many have attempted. However, there are some who have complained of foot pains after starting this new habit. So, what could be the cause for such foot pains? Can we claim that these foot pains are merely walking induced? Now, in reality, if you look into a foot, which actually helps to bear our weight and also helps in movements, it is actually a very complex system. We have around 26 bones, we have around 30 joints, and we have over 100 muscle tendons and ligaments, which all work together to provide support, balance, and also all the while helping in mobility. So if we look into a foot pain, there are many things which need to be considered. There are many possible causes for a foot pain to develop. The common cause for foot pains are usually the mechanical causes, either due to overuse or maybe the use of improper footwears. It can also be due to muscle imbalances or poor foot biomechanics. Now, the foot biomechanics are usually the cause for pain when there are irregularities structurally, such as a flattening of the arch of the foot, or maybe if an increased pressure is unduly being placed over any small part of the foot. Plantar fasciitis is a well-known cause for foot pain, and it is usually seen when you rise up in the morning, when you start taking the first few steps, or after a short duration of rest. It is usually due to the involvement of the plantar fascia, which is a soft tissue found over the sole of the foot. And it can be induced. This pain can be induced when you try to pull your foot and the toes upwards towards the knee. Another cause for the pain over the soles is the heel pad syndrome. Now, the heel pad is a fat pad which is found over the soles and the heel, and it acts as a shock absorber, acts as a cushion, and it also protects the heel when you're walking, running, or even jumping. Now, this syndrome occurs when there is a thinning which occurs in the fat, and this leads to pain which quite often mimics plantar fascia. The typical pain pattern is seen when you find that the pain is increasing when you walk on barefoot over a hard surface. Another cause for the foot pains, especially in the old age, is due to the degeneration or the wear and tear, which is known as the arthritic pain. Now, here the pain is associated with stiffness. Another cause for the foot pain is due to the involvement of nerves, where we find that the nerves which supply the foot are getting entrapped or getting compressed, either due to trauma or due to any other inflammatory changes. Now, in such cases, we find that not only will the patient be having pain, but they may be having associated symptoms such as burning type of pain, or maybe tingling sensation, or even numbness. Now, not only the nerves which are locally present over the foot, but the pains can be due to the cause such as disc prolapse over the spinal nerves, over the lower back. And in these cases, we find that the pain is actually radiating from the lower back to the foot. Also, the attachment points of muscles, these also have a role to play when it comes to foot pains. We find that the point of attachment of the muscles to the bones, which are known as the tendons, can actually get inflamed either due to overuse or maybe to some other trauma, and it can lead to conditions known as tendinitis. The most common one would be seen, for example, the Achilles tendinitis. Now, here the typical pain is not seen over the sole of the foot, but rather over the back of the foot, and it gets worse when the patient is actually walking for a long duration of time. Infections also have their role to play as far as foot pains are concerned. We find that we have a common condition known as foot corns or maybe plantar warts, which are due to virus infections, and these also present as pain, especially when you're walking or weight bearing over that foot. Now, the associated symptom which can be seen is that we will find that there is a thickened area over the sole, especially over the area where there is pain. So, apart from the local causes for a foot pain, there may be other systemic diseases which also contribute towards foot pain. For example, diabetes mellitus. In patients with diabetes mellitus, we find that they have foot pains either due to the involvement of nerves, or it may be due to some other complications. For example, the formation of a wound or a foot ulcer, which is the cause for a foot pain. So we find that the cause for foot pain being so very varied, its management also needs to be different. Ayurvedic approach towards a foot pain considers many factors when planning a treatment, and one of them is the symptoms which the patient presents with. So an Ayurvedic approach to a person who is having food pain, either due to overuse or maybe increased stress to that area, we would advise them to take rest along with bandages, which can be applied over medicated oils. Now, this has to be done along with proper internal medications to relieve pain as well. On the other hand, if the patient is having food pain due to degenerative cases or maybe wear and tear, we would advise the patient to continue the rest along with maybe a more supportive treatment modalities which can be done externally, and internal medication will be specifically having a nourishing type of a property which will help to reduce the consequences of wear and tear. In other typical food pains, for example, due to an inflammatory cause, for example, in case of plantar fasciitis, we would be advising a treatment modality known as Agni Karma. Now, in Agni Karma, we are taking into consideration that the area has an inflammation, it has an inflammatory swelling which is being present over there, and we have to try to increase the circulation to that area so that the inflammatory swelling can be removed from that area. Now, Agni Karma is usually done by providing high heat to that area for very short durations of time. This increases circulation to that area, and it also stimulates the factors which will help to reduce the inflammation in that area and thereby reducing the symptoms of pain to that patient. However, Agni Karma cannot be universally applied in case of plantar fasciitis or inflammatory causes of pain, because there are certain contraindications. For example, if a patient is coming with a condition where there is pain associated with a burning sensation, Agni Karma would not be ideal. In those cases, there are other treatment modalities which can be done. For example, we can use a leba in which we are applying medicated pastes over that area, or the food can be immersed in medicated decoctions, or maybe the decoctions can be poured over the area, and all of these help to remove the inflammatory swellings. And we also have a treatment modality which is known as Jaluga Avajarna, in which we use the medicinal leeches so that the anti-inflammatory actions or the anti-inflammatory factors over that area can be stimulated. So in similar conditions of burning sensations, where we find the involvement of nerves, which is known as the entrapment neuropathies, there will be associated tingling sensations or maybe even numbness, we in Ayurveda consider the involvement of Vata. Vata is among the three elements of the body which is involved in the movement of the body. So when we are looking into an entrapment neuropathy, we are trying to remove the obstruction which is causing an interruption in the flow of Vata, and this is usually directed by using appropriate internal medications. So the next cause of food pain, which was mentioned as infections, where we will be looking into the plantar warts or the food corns, Ayurveda prescribes the removal of such food corns by excision, and then this is followed by thermal cautery, which is application of Agni Karma to that area so as to prevent a recurrence. So when a systemic disease is a cause for the food pains, for example diabetes mellitus, which is causing a food pain, it would be ideal to keep the blood sugar levels at normalcy. In Ayurveda, what we do is that we advocate not only local treatments in such cases, but we also prescribe classically mentioned treatment modalities for such diseases. For example, we would advise the treatment of prameha so that it can also contribute towards improving the condition of food pains. Due to the innumerable causes for food pains, it is very important to rightly diagnose and get treated at the earliest. Now, even though I have mentioned only about the internal medications or maybe the external medications, we have also to look into the proper footwears that you'll be using while you're walking, as well as the need for appropriate stretching as well as strengthening exercises of the foot when you start to walk. Ayurveda advocates early diagnosis and early intervention. A right diagnosis at the right time can help prevent complications or maybe a need for surgery in the future. Ayurveda thus could help in controlling food pains. It can help in maintaining the quality of your life, as well as you could also inculcate the health benefits of walking.